So, welcome for those of you that don't know me or haven't taken a class with me before. I'm Dr. Ellen Potvin, and I'm a naturopathic doctor in Biddeford, Maine. And my primary focus in practice is women that have some sort of autoimmune disease, chronic digestive issue, and it's really, really common for endometriosis to be part of the picture. And we'll discuss a little bit as to why that is. So it's something that I see frequently in practice. Last month, March, was Endometriosis Awareness Month. And so I wanted to put something together for an online class for people to access, because as an ND, the perspective is a little bit different in terms of how you would work with the symptoms of endometriosis and the root cause. And really, the biggest difference is that you're not masking symptoms. You are working with, or at least trying as much as possible to work with root cause of the condition, and that's going to be individualized for everybody. So many people will come into the practice with endometriosis, but why it's manifesting for them, or the way in which it's manifesting for them, is going to be different for everybody, but also on a spectrum. That's something I always like to emphasize with people, is that especially with chronic issues like autoimmune disease and endometriosis, you're looking at a spectrum of symptoms for that, and everybody will experience it a little bit differently. So that's why care has to be individualized. So naturopathic care is really helpful for that. So today we're going to be, I'll give you the roadmap of our discussion for tonight. A little intro to endometriosis. I'm assuming for those that are signing up or signed up to do this webinar, that you're familiar with how endometriosis works. But we're going to recap a little bit just in case that's something that's a little fuzzy for people. We're going to look at some of the major contributors to endometriosis, essentially root cause of endometriosis. This is something that's not generally discussed because from a conventional perspective, the treatment will essentially be the same every time, regardless of the contributing factors. So what I found, though, is that identifying those contributing factors and working with them can be incredibly empowering and helpful at improving quality of life. So major contributors to endometriosis, we're going to dig a little bit deeper into environmental factors that influence endometriosis, as well as the connection between autoimmune disease or autoimmune tendency and endometriosis. So that's something that isn't talked about very frequently, but really we've known about the connection for decades now. And then we're going to go into naturopathic considerations. So what kind of patterns and principles are we going to follow to work with endometriosis? We're going to highlight nutritional support, some of the main nutritional considerations. Again, these would be individualized for each person, but what are some of the common trends that I see that can be helpful regarding treatment? We're going to look at stress management, mood support. This is a really key component to working with endometriosis, and particularly with the population that I work with. That's a very large factor in autoimmune care as well. We're going to discuss structural support to a certain extent, herbal support, a very brief overview of some of the herbs that I personally like to use with women that have endometriosis. Again, it'll be a review. There's quite a few herbs actually that have been used traditionally that I don't necessarily use with my patients, but we'll be talking about the ones that I have the most experience with in practice. And then we'll do wrap up and Q&A. But again, you are always encouraged to put your hand up or type into the chat box that's down in the lower corner there. And I believe if at any point you would like me to unmute you, because I'm not sure you're able to, change that on your end. If at any point you want me to unmute you so you can just talk or ask a question, by all means, just let me know in the chat box and I'll do that. So, an introduction to endometriosis. Endometriosis, very generally speaking, is the occurrence of endometrial tissue outside of the uterus itself. And this can be a number of different places in the body, though the most common spaces are still within the pelvic cavity, usually in the rectouterine pouch, which is just behind the uterus. However, one thing that I've really started to realize with the women that I work with is that there are certain places where endometrial tissue will collect that's more common than you would see in the literature or in books. Actually, within the rectum is a really common space for endometrial tissue to collect. And we determine that by paying attention to bleeding during menses rectally. So you can have endometrial tissue in a number of different places in the body. In some women, you have endometrial tissue that collects in the lungs or in the rest of the respiratory system, which is only really obvious when that woman is menstruating. So it can be really expressed in a variety of different ways. And certainly the symptoms are fairly diverse for endometriosis. But it's something that they estimate impacts 10% of reproductive age women. And I will say that if the occurrence of autoimmune disease, a related grouping of conditions, is any indication, this is probably a very gross underestimation of the amount of people that are not necessarily experiencing endometriosis to the point where you would be able to diagnostically see it on a laparoscopic procedure. However, they're still within that spectrum of endometriosis expression, meaning they do have some endometrial tissue that will be outside of the uterus. It is the leading gynecologic cause of hospitalization and hysterectomy, at least in the US. And what I see particularly in Maine is that there's a really high incidence of women in their 20s and early 30s that are having to undergo the pretty significant surgical procedures, hysterectomy being the most extreme, to be able to just have some quality of life. And it's associated with as much as 25% of infertility cases. So even if a woman doesn't necessarily express to the point of being able to have a full diagnosis of endometriosis, it's still very, very much associated with infertility cases. And so it's something that's worth exploring, even if a woman doesn't have a diagnosis. If she's looking to conceive and is struggling with that, it's something that we look at. It also, interestingly enough, is related to a number of other comorbidities, and vaginal infections is one of them. So sometimes, if I have a woman that comes in that perhaps has, yeast infection after yeast infection after yeast infection, we may start considering that there's obviously an immune factor that's part of it, but there may also be restrictions and adhesions in the pelvis that are contributing to the arisal of those kinds of infections. So again, as a naturopathic doctor, I have to kind of expand my lens often to be able to figure out root cause for these patients. So that's a general introduction to endometriosis as a condition. There's a lot of contributors, and this is something that I really, really have to emphasize to people that are trying to understand their bodies better, trying to understand how to take care of their bodies better, is that there's very rarely a single cause, particularly with chronic issues that have accumulated over time. Endometriosis is no exception in that case. So we have oftentimes a number of different contributors that are influencing uterine health all at the same time. There's a lot of theories as to how endometrial tissue actually gets itself out of the uterus in the first place, but then we have to look deeper at that into root cause and to understand why that endometrial tissue decides to stay, and why does an inflammatory condition perpetuate. One thing that is agreed upon kind of across the board is that endometriosis, a large contributing factor to that is estrogen dominance. That is, estrogen is higher or elevated relative to progesterone and other hormones. And what we know is that there is a relationship with the amount of endometrial tissue outside of the uterus and cases of estrogen dominance. There's not a ton of very clear evidence about whether or not things like oral contraceptives, for example, which is a common treatment, conventional treatment for endometriosis. There's conflicting evidence as to whether or not that is beneficial for women. Some women really do find symptomatic relief from oral contraceptives, but other studies have shown that it's possibility that particularly mixed oral contraceptives, estrogen, progesterone, there may be an actual contributing factor to the worsening over the long term of that condition. There appears to actually be an elevated risk in endometriosis for women that develop the condition after they have been on oral contraceptives for a bit of time. So there could be a relationship, but we do understand that women that experience estrogen dominance constitutionally have much more significant expressions of endometriosis. So the presentation is that much more severe. We do also understand that there's immune factors and inflammatory mediators that are responsible for the expression of endometriosis. And by that, I mean that when the body is in an inflammatory state, it creates a lot of different inflammatory chemicals that have a purpose, that are beneficial and helpful, but not for long term, like what we would see in an inflammatory condition like endometriosis. And that further irritates the tissues that are not meant to be carrying endometrial tissue. So to illustrate it a little bit better, say, for example, endometrial tissue is hanging out inside the pelvis, but not inside the uterus. The woman has her menses, and the bleeding that occurs with that endometrial tissue, because remember, the endometrium is supposed to be that inner lining of the uterus that gets sloughed off during the period. If that's going to be bleeding on the inside of the pelvis and not in the uterus, blood pools within the tissues. That triggers pretty significant inflammation inside the pelvis. And one of the side effects of that inflammation is scarring, is that the tissues get sticky and adhere together. And that perpetuates an inflammatory cascade. So it's kind of like a domino effect. There are also a number of immune factors that we're going to talk about shortly that really contribute to endometriosis. So it's kind of what a lot of people describe to me is that it's once you put out one wildfire, it's like another one pops up. And they see that when they're having surgical procedures to remove endometrial tissue from different parts of the body. They're not always successful at getting it all, and it can really self-perpetuate like that. Some additional contributors to endometriosis. Hi, Amy. Thanks for joining us. Some additional contributors to endometriosis. There are some thoughts that there is a genetic connection, but not necessarily with milder forms of endometriosis. They do see some familial connection with more severe forms. So not a really clear-cut genetic connection there. Another big contributor is environmental factors. So what we refer to as endocrine disruptors. And we're going to talk about those in a little bit more detail in just a bit. But I want to check in with everybody. And if you can try, I'm not sure if all of you are able to get into the chat box there, but if you have any questions, definitely let me know now. Anything that's kind of come to mind for any of you, any questions that have come up, by all means, type them there. Doesn't look like I'm seeing any. Well, don't hesitate to type anything out in that chat box. So a key factor in the development of endometriosis and the perpetuation of endometriosis are environmental factors. So there's a ton of studies, and actually at the end of the slideshow, I do have a resource page for you to be able to, if you're interested in reading papers and things like that, books, I do have the resources at the end for you. One thing that they've studied pretty extensively at this point, though I would say there's not necessarily a ton of, not as many cases and double-blind controlled tests to be able to monitor the relationship between endometriosis and some of these. But we do see a lot of connections, particularly between these chemicals that we have in the environment and infertility. And a lot of the infertility studies are with populations of women that have endometriosis. So it's a bit of an indirect way to look at the relationship, I guess is what I'm trying to say. But what we do understand is that these constituents in particular, things like phthalates, BPA, dioxins, and PCBs, a lot of these can be found in things like tempered plastics. Soft plastics is where you'd find phthalates, flexible plastics, body care products, pesticides. Most of our exposure for things like phthalates, BPA, dioxins, and PCBs are through our food or through the things that we use to eat. That's where a large part of our exposure comes from, in addition to body care products. However, what we understand about these chemicals that are part of, for the most part, plastics, is that what they do is that they mimic estrogen and they can interfere with normal estrogen metabolism. So what we were discussing earlier was that we know that endometriosis is greatly influenced by relatively higher estrogen and can be aggravated by that. So when we have all of these estrogen mimicking chemicals in our environment, that also can mimic that estrogenic effect and influence the occurrence of endometriosis. In addition to that, it also, these kinds of chemicals can also interrupt proper functioning of the immune system, which really increases the likelihood of inflammatory cascades. And we know that endometriosis is an inflammatory condition. So it's essentially like throwing fuel on the fire. In addition to that, most of these chemicals have the capacity to accumulate in the body because they're fat soluble. Women have higher fat stores than men do on average, and so you do have this increased likelihood of accumulation of these endocrine disruptors in the body. They also seem to have this preferential affinity these chemicals have an affinity for the reproductive organs for that reason, because of their estrogen mimicking capacity. And so over time, it can actually increase the likelihood of estrogen dominance and also influence that inflammatory experience in the body. So the environment really greatly influences endometriosis and how it manifests in the body. So when we start getting into some of the treatments and support that you can do, a lot of it is kind of looking at your environment and seeing what you can do to reduce exposure. Now, you really can't remove exposure altogether. We're exposed to plastics everywhere, all day, every day. But being very mindful of the foods that you eat and the things that you use to eat can be huge. Now, I've mentioned a few times that endometriosis has a really strong relationship with autoimmune disease. And for those of you that aren't familiar, autoimmune diseases include things like Hashimoto's thyroiditis, rheumatoid arthritis, lupus. And essentially, the mechanism for an autoimmune disease is that the immune system starts to attack self-tissue. And so what we've begun to understand over the last few decades is that endometriosis actually follows a lot of the same patterns as those autoimmune diseases and how they run their course. So we see elevated levels of inflammatory chemicals in the body, these cytokines, which again have a purpose, but they're not meant to be turned on at 100% all day. In both autoimmune disease and endometriosis, we also see a decreased rate of normal cell death. So what this looks like in endometriosis is that normally the immune system would see endometrial tissue outside of the uterus and go and turn it off, place a timer on the lifespan of that endometrial tissue, because it's in a place where it's not meant to be. However, the body almost loses its capacity to do that. And so you have this perpetuation of endometrial tissue outside of the uterus, where normally it would just get cleaned up by the immune system. So in that way, that's also a process that we see in certain autoimmune diseases as well. And then another thing that we see is that in both autoimmune disease and endometriosis, there's abnormalities in white blood cell types. So we see malfunction of them in a lot of different ways. So this is part of the reason why, from my practice perspective, I see a lot more people with endometriosis, because I work primarily with people that have autoimmune disease. So there's definitely a crossing there and a sharing. And in a lot of ways, the things that we're going to get into very shortly in terms of treatment and support for endometriosis are very similar to what I would be recommending to somebody that has an autoimmune disease but doesn't have endometriosis. Because from a naturopathic perspective, you're trying to work on these principles and these larger patterns. And if something has the same root cause, you're going to get similar treatments. Are there any questions before we start getting into some of the treatment stuff, some of the supportive care? You're more than welcome to type any questions into the chat box. And if you want me to unmute you, definitely let me know. Oh, good. Well, if anything, as we're going through treatments and supportive care, if there's anything that maybe you want to, if you want to check back with some of the introductory stuff at all, if something's not clear, definitely let me know. So from a naturopathic perspective, as I mentioned before, I'm looking for patterns, and I'm looking for themes in the picture that I see. I'm really trying to get a bird's eye view of the case, and not even just looking at things on the physical plane, but looking at a person's emotional self, their spiritual self, their how they interact with their environment, what's going on in their social sphere, because that's all going to greatly impact their ability to heal. So it's really a multifactorial approach, and you really have to address the multifactorial nature of any chronic condition. Big thing for people, especially immediately, is to reduce inflammation. Generally, you don't want to suppress inflammation. That's actually a healthy mechanism that your body has. But in this case, you do need to open the gasket a bit because chronic inflammation isn't healthy. So we help with the management of inflammation. We also want to ensure that all the organs of elimination are working. Now, remember, when we were talking about endometriosis, and one of its contributors, or one of its causes is the estrogen dominance that occurs in the women that experience this. And we have organs of elimination that are responsible for helping us get rid of excess hormones, primarily the bowels. And so if a person's bowels aren't working well, if they have a hard time with bile flow to assist their bowel movements, then you're going to have a really difficult time actually processing and getting rid of excess hormones. So ensuring that all the organs of elimination are working is key. This is to help improve hormone balance. But gut health in general is going to be really, really key. If there's inflammation inside the digestive tract, there's going to be inflammation systemically. If there's inflammation systemically that's not necessarily rooted in the gut inflammation will continue to aggravate that additional inflammation. So most of your immune system is living inside your digestive tract. And so to be able to rein in that inflammatory cascade, which is essentially an immune response, you have to really bring about structural integrity to the gut and really help it heal. So gut health and stress management are really core to all of the treatments. In addition to that, you want to improve nutritional status and correct any deficiencies. There is some correlation between certain deficiencies and some of the symptom pictures of endometriosis. For a lot of women, especially if they've been experiencing severe endometriosis for some time, there will be some structural contributors. The body adapts to pain to help it protect itself from pain. In endometriosis, you also have adhesion formations inside the pelvic cavity, inside the abdominal cavity, sometimes beyond. So what that means is that you have tissues sticking together that shouldn't be stuck together, and that can be a huge contributor to extreme pain for women, particularly if that sticking of tissues together starts to pinch on nerves and things like that. So you have to really address some of the structural contributors to pain as well. And finally, reducing environmental exposure to aggravating factors. So the endocrine disruptors that we talked about earlier, and also, exposure to other things like heavy metals. You get a lot of that in cigarette smoke, etc. So really looking at the environment. So these are some of the main considerations that I would take on if I was looking at a case of endometriosis. This is not an uncommon list for a lot of chronic diseases in general, but you fine-tune it based on the presentation of the person and how they're experiencing it. So when we look at nutritional support specifically, you can see that I've written anti-inflammatory diet on the top. What does that mean? I'll be honest, that can be a little bit different for each person that I've worked with. However, generally, we'll at least go forward with removing some of the larger offenders that impact most people. In my experience, sugar is number one. I find that wheat and gluten-containing products are variable. What I've seen is that people tend to be more sensitive to corn-derived products than wheat and gluten, but we will remove wheat products that have gluten, or just gluten-containing products as a trial. And I will preface this by saying that a lot of this is done by trial and error, and it takes time. So sugar, corn-derived products, glutinous grains can be an issue for people. Dairy can be a really big issue for people. For some women that are particularly sensitive to soy, we'll remove that. And alcohol and caffeine tend to be aggravators for a number of different reasons. But what I generally do with women is have them at the very least remove those offenders. And by offenders, I mean inflammation that, triggers. And pay attention. This is a really great body awareness exercise. So there's a few different reasons why I'll have women eliminate those foods and then try to reintroduce them. Firstly, your body will really tell you what's bothering it. If you've taken something out for 5-6 weeks and then you add it back in, your body will tell you if it doesn't like it. It's also a really great exercise to help people that are experiencing something like endometriosis, helping them get back in their bodies. Because when women are in constant pain, or when anybody's in constant pain, they don't want to be in their own bodies, right? So this is an anti-inflammatory diet helps reduce inflammation immediately, helps identify which foods are most problematic for a person, that helps stimulate that inflammation response, but also are a great way for a person to kind of get reintroduced to the rhythms of their body, where they may not have wanted or even unconsciously been able to do that before. So an anti-inflammatory diet can be a really powerful way to help further the diagnosis or understand the case better, but also as a treatment. We also have to be mindful of certain mineral deficiencies. I find that as a population, we tend to be pretty mineral deficient, particularly magnesium. This is an example of one that people are often deficient in, because we need a pretty significant amount of it to recycle and break down cortisol, which is our long-term stress hormone. And so it's really not uncommon for people to not be able to have enough in their food, in their diet, to make up for, us walking around like a bunch of stress balls all day, as we do here in the Western world. So magnesium is oftentimes a symptom of magnesium deficiency is oftentimes inflammation and also muscular tension, which certainly isn't helpful for a very muscular organ like the uterus. So correcting mineral deficiencies can be really key. Now, I generally am not doing things like blood tests to look for magnesium, just because it can vary pretty significantly depending on what you ate that day. Even if you fasted for a while before you take it. I'm not usually testing magnesium. I'm paying closer attention to symptom picture and case history. Some practitioners do it differently, but I find you can get a lot of information from the case history itself. Vitamin deficiencies as well can be a contributing factor, particularly vitamin D. There's some thought that vitamin D deficiency can be a contributor to the inflammatory cascade that really aggravates endometriosis. But what we also understand is that vitamin D is really key for modulating the immune response and helping rein in autoimmune response. So vitamin D is a key nutrient that's missing for a lot of people that are experiencing things that have roots in autoimmunity like endometriosis. So I always think it's very beneficial to check vitamin D status and supplement as necessary. B vitamins as well are water-soluble nutrients that people tend to wick off more in times of stress. We need them to process hormones and neurotransmitters. And B vitamins are also really essential for liver function. And the liver is one of the primary organs that estrogen is processed through before it's actually sent out and recycled and gotten rid of via the feces. So you have to make sure that the liver is functioning properly, and it needs B vitamins to do it. So again, you can do blood work, and I do for certain B vitamins like B12, but you have to be mindful of just the presentation as well in determining which ones. Oftentimes, there's a lot of thought that essential fatty acids and the deficiency of essential fatty acids in the diet can be a contributor to inflammation. Especially omega-3s are really essential for helping rein in an immune response and an inflammatory cascade. So getting in, healthy fish oils into the diet can be really key. Getting in omega-9s like olive oil, walnuts, raw walnuts, things like that can be really beneficial. And what I do see is, I see less of it now because fat-free diets aren't the fad right now. But I remember when I started practicing, there were still a number of people that were doing a fat-free diet. And I did see pretty significant inflammation as a result. Once we started getting in some of the healthier oils, that resolved. It's also really important, if we're talking about keeping your organs of elimination properly working, getting in that fiber. So for women, the recommendation is getting in at least 25 grams of fiber per day. And you can get that in the form of, ground flaxseed, chia seed, getting in plenty of vegetables, all of that stuff. But what that does is that it helps alleviate that estrogen dominance that's a contributor to endometriosis. So really making sure that you're regular is key to hormone balance and really key to the proper health of the uterus. I also will oftentimes recommend different forms of liver support. And I do oftentimes do that in an indirect way. So the question I ask myself is, how can we support both the digestive tract itself and help reduce inflammation there, and support liver function? And that often will require people to at least cut back on caffeine and alcohol, both of which can, gunk up isn't exactly the right word for it from a physiological perspective, but it does interfere with liver function over time, both caffeine and alcohol. So reducing that can be greatly beneficial for reducing inflammation and reducing pain in cases of endometriosis. I also really like to recommend bitters formulas. For those of you that aren't familiar, usually those are formulas that you can find in a lot of health food stores. They might be called Swedish bitters or something like that. You've probably seen them if you've checked out any tincture section. The introduction of bitter herbs like gentian or yellow dock dandelion, those are helpful at stimulating the body's production of saliva, stomach acid, bile, and releasing it. It can be a really helpful tool to be used before meals as a way to stimulate the digestive process. But it also is supportive of bile release, which indirectly is going to be helpful to the liver. So you can support the digestive tract as part of your nutritional support, if that makes sense. Now remember that mineral deficiencies are oftentimes a key part of endometriosis and the inflammation that results. So I'm a really big proponent of tonic teas, and we're going to talk more specifically about herbs in just a little bit. But I find it's very helpful to have a regular use of what we refer to as nutrient-dense herbs in the diet. And these are, in particular, pretty mineral heavy. So things like seaweeds, which is technically an algae, nettles, and red raspberry leaf. Those are two that I oftentimes will prescribe as a tea. And very nutrient rich, particularly with minerals. And the red raspberry leaf in particular does have a tonifying effect on uterine tissue, though more so on the muscle. But I find that the nutritional uptick in minerals can be really helpful at reducing an inflammatory cascade. Minerals in a way are almost cooling to the tissues in the way they're acting, chemically, but they essentially have a cooling effect on the tissues overall. And so I really like to invite people to use things like more mineral-rich teas on a regular basis. It hydrates them, and it also makes sure that they get minerals into the diet. That's a really good question, Rachel. So there's some thought that soy has a estrogenic effect, but what we're starting to understand now, I think it's been more in the last 3 or 4 years, we've been seeing studies of showing that it has more of a modulatory effect. But some women are still aggravated by it. This is one of those foods where I would say it's kind of on a case-by-case basis. I know for myself personally, I'm greatly aggravated by it, but a lot of women aren't, and it doesn't necessarily boost estrogen levels per se. It modulates it. So that's one example that you'll probably read about more frequently. I would say that one thing that definitely increases an estrogen or has an estrogenic effect would be things like beer. Not only because of the alcohol content, it can influence that, but because of the hops that are in it. So if you're reducing alcohol, you don't have to worry about that too much. But I would say that soy products are usually the one that people are most concerned about. Yeah, if anything else comes to me, I'll let you know. But usually what you have to be most concerned about is, are you eliminating properly? So if you're eating foods that perhaps are estrogenic in nature, even more important than removing that in general is making sure that you're eliminating estrogen, because a lot of estrogens are actually produced within the body. They're not all coming from environmental factors, and not just from it's not just being produced by the ovaries, I guess is what I'm saying. The higher the adipose tissue content, so more fatty body mass that a person has, that fatty tissue, particularly on the abdomen, actually produces a fair amount of estrogen. So being mindful of food and environment is really key. But for a number of different reasons, you're going to have to be even more mindful about just making sure you're eliminating regularly. So good question though. And if there's anything else, people throw them in there. I like questions. So like I mentioned earlier, stress management is really key. Not only because when a person has endometriosis, if it's a severe case, they're usually in chronic pain. That's inherently stressful. That inherently will increase cortisol. And the unfortunate thing is that cortisol elevation actually increases perception of pain. So it's like this loop. You know, the pain causes stress, and the stress actually increases how you perceive the pain. So stress management is really key. We also understand that stress and the hormone changes that result from stress can greatly aggravate autoimmune tendencies. And usually what I find with patients that I have that have autoimmune disease, in addition to endometriosis, is that they have their flares are definitely influenced and aggravated by stress. So, you know, some of the things that I recommend really are more lifestyle based, though I do love herbs to help support the adrenals and support the nervous system. But things like breathing exercises are really, really key. One that I recommend often, just because it's really easy to remember, is called the 4-7-8 breathing exercise. So all you have to remember are the numbers 4, 7, and 8. And what you do is that you inhale on a count of 4 seconds. Then you hold your breath for 7 seconds. And then you exhale on a count of 8 seconds. So essentially it makes you exhale at twice the amount of time that it takes you to inhale. You can do about 3 cycles of that each time you stop to do a breathing exercise. And what that really helps do is stimulate that rest and digest mode, which is the counter to your fight or flight mode, right? I find that breathing exercises, if done regularly, help people become less reactive in times of stress. And definitely can assist during times of pain as well. Breathing exercises can be really key for that. Laughter is something that I recommend often. You know, I've even gone so far as to prescribe certain YouTube videos. And people do find benefit, obviously, in severe pain. I'm not trying to be trite. Obviously, in severe pain, finding humor in situations is difficult. But particularly in mild to moderate cases of menstrual pain, laughter and watching funny videos can actually be really helpful because of the endorphin release and dopamine release. So it's not uncommon for me to prescribe something like that, just because it's helpful for a number of different reasons. One of my favorite stress management techniques is getting outside. Not only for myself, but I do prescribe it a lot. One thing, particularly here in the Northeast, we're lucky. We have all these evergreen forests. Getting outside for, even 20 minutes a day does help with immune modulation. So if we're looking at endometriosis as an inflammatory disease, as one that is potentially autoimmune in nature, getting outside and being in the natural world, actually, it's been shown that doing so does help with those two things. It helps with stress management, but also very directly can impact immune function and inflammatory cascades. The studies that have come out about that are more focused on evergreen forests. That's why I brought that up earlier. Because of the essential oils that are produced by evergreen forests, things like spruce, fir, pine. Part of the immunomodulatory effect actually comes from you breathing in those essential oils. So I always recommend, if somebody really wants to have a good walk in the woods, wait until after a rainfall, assuming the mosquitoes or botflies aren't too bad. And that way you're getting, in addition to just being in a beautiful place, you're getting that additional benefit of those essential oils. The herbs that I like as more tonifying herbs for the nervous system and adrenal support, I prescribe a lot of milky oat seed or oat straw. Same plant, 2 different parts. Skullcap is a really favorite loose leaf herb for tea that I prescribe a lot. And milky oat seed and skullcap, more so than licorice, are focusing on supporting and tonifying the nervous system. So they're not sedating herbs. They're not herbs that will cut pain. But what I do find is that over time, they improve the reactivity to pain and to the stress. That is, a person will be more responsive and less reactive. They'll find it they're more readily able to be in stressful situations and not have such an extreme stress experience. So it improves resilience in that way. Licorice is an adrenal herb that I really like, also for its immune benefits as well. Are there any questions before we start talking about some of the structural support stuff? Anything that's not making sense for people or that you'd like a little bit more clarification on? We're covering a lot of information. You're probably going to want to watch this again later. And that also brings me to the recording. I will, in the next 24 hours, get you the recording video so you can go back. What I'll also be doing is sending you the slideshow notes with it as well. So you have some of that in written format as well. But like I mentioned earlier, structural support is something that we oftentimes forget when we have chronic disease. Unless it's very obviously related to the muscular system or to the skeletal system, we forget about how the body compensates and how the tissues acclimate to things like chronic pain and chronic inflammation. So some of the most powerful modalities that I actually recommend to people when it comes to endometriosis care are actually hands-on mechanical work that they do with themselves, stretching, physical therapy, because the cells have a memory, particularly for pain. And I find oftentimes for women that cellular memory and the memory of the nervous system really, really influences the ability to heal. On a physiological level, but also on an emotional level. There's a lot of chronic pain that's directly associated to endometriosis, but the emotional pain that is related to the physical pain, even long after the physical pain is gone, can be just as debilitating as it was originally. And so really, really key to get tapped into helping the cells and the tissues remember how to be healthy, if that makes sense. One of my favorite recommendations, and I'll be sending you all instructions for this as well with your video, is self-abdominal massage. There are some providers that you can actually see for things, I believe Mayan massage is a modality that's incredibly beneficial for endometriosis. But for those that can't access Mayan massage, I usually will provide a routine that they can do for themselves. It's a 10-minute abdominal massage routine that they have to do nightly. The key, or at least some point in the day, the key is consistency. And what I find it helps most with is getting the lymphatic going in the pelvis and the abdomen to help reduce inflammation. And also over time can really help break down some of the milder adhesions. Now, obviously there's pretty severe adhesions that would require probably something like more consistent visceral manipulation, something like that. Osteopathic doctors oftentimes do that if they do manipulations at all. But from a self-care perspective, abdominal massage is something I recommend to most women, not only that have endometriosis, but also that have other, reproductive issues, fertility issues. Hydrotherapy, there's a variety of different kinds of naturopathic hydrotherapy. From an anti-inflammatory effect and immune modulating perspective, the contrasting of hot and cold water on different parts of the body is actually really, really powerful for reining in that inflammatory response. So one of my favorite types is contrast shower, which is something that I do most mornings. And it can be quite abrupt to the system, but I wouldn't recommend it if I didn't, have the gall to do it myself. So I find it can be really helpful for women that have, lymphatic struggle with fluid retention. So they clearly are struggling with lymphatic function. And also at different points in the cycle, it can be hugely beneficial for that. And also as an overall anti-inflammatory, systemic anti-inflammatory. The contrast shower that I was referring to, general routine is that you do about 1.5 minutes hot in the shower, and then you turn it to as cold as you can get it for 30 seconds. And this is where people are like, no, I'm not doing that. But if I can get them to try it and do it for about a week, usually people start to enjoy it after that, or at least are tolerating it by that point. So it really, really helps, again, with that inflammatory response, and indirectly with filtering of blood, removal of hormones, et cetera, et cetera. Focusing on the hips can be a hard thing for women to do when they're in significant pain, when they have endometriosis. But really taking the time to stretch, focusing on hip opening exercises. I like recommending the sun salutation routine, which is a really common yoga routine that opens the chest, opens the hips, done consistently. And again, the key with most of these is adding them consistently into the routine. If I can get most of these routines so the abdominal massage, the hydrotherapy, the stretching, something like a sun salutation, each of those usually takes about 10 minutes. So if I can get somebody to do one, but consistently, they're going to see benefit from it. And not to say that we're striving for perfection by any means with these kinds of exercises. That's not a realistic expectation, particularly with debilitating, potentially debilitating conditions like endometriosis. But consistency really goes a long way with these. And then I also have, over the last few years, really tried to make good referral contacts with physical therapists that specialize in pelvic floor health. particularly because a lot of women need to do biofeedback because of the extreme pain that they might experience on a regular basis, but also particularly during intercourse, a variety of different things like that. Its influence on the other pelvic organs, influence on fertility. I think it's always wise to establish a relationship with a really good pelvic floor physical therapist. And thankfully, at least in Southern Maine, we do have at least a couple that I like to refer to. Any questions so far before we start talking about herbs? This stimulate any thoughts for any of you? No questions? No worries. You think of anything, you just throw it in there. So just to recap a little bit, actually, again, just to emphasize that really any plan that we put together, things that I invite patients to do, usually we have to kind of pick something from each of the categories that we've discussed. And there's no silver bullet really for any chronic condition, but even with something like endometriosis, it's really, really key to introduce support in all of these different pillars of the human experience. And herbal support is a really powerful way to work with endometriosis. But I will say, I always find that the herbal support works that much better if you do some of the other stuff, particularly with nutrition and movement. Herbal support can oftentimes not work as well if you don't work on those things. So in terms of prioritizing, usually I'm using herbal support with patients relatively immediately, but we see additional benefit once we really get some of the food routines and all that stuff down. So with the groupings of herbs, again, I'm going to be discussing ones that I use more commonly, or that I have patients that have come in that use them, that have seen great benefit. I've divided them into a few different categories because herbs are, and you'll see that there are some herbs that are going to fall into a few of the categories, because herbs are delightful in their whole form in that way, and that they oftentimes are going to address many systems at once. So one of the joys of formulating an herbal support for people is being able to find those herbs that are going to be helping with their symptoms in a number of different ways. So when we look at herbal support for women with endometriosis, a large concern, of course, is pain. Now we have to ask ourselves, though, instead of just trying to suppress the pain, where is the pain coming from? And so that's going to greatly influence which herbs get chosen. Now, one of the things I oftentimes have to consider too is, are women on medications already? Are these herbs that will help improve some or get rid of the side effects of some of the medications they're on? Can we replace any medications? It's really quite common for women to have digestive issues that have endometriosis, specifically because they're taking things like ibuprofen and Tylenol on a regular basis. So oftentimes you have to actually help the body heal from that, in addition to supporting with herbs as well. So with more, I guess, sedating, um, more instantaneous kind of pain relief. In the state of Maine, we can't, NDs can't prescribe medical marijuana, but I've had a lot of patients that have come in already using medical marijuana, and they find it to be greatly beneficial for them. If I suspect that it would be a beneficial herbal ally for that patient, then I will usually refer out to, some of the local experts in that area. But that is certainly an option that I see a lot of women really benefit from. I personally like, I use a lot of Chinese formulas in my practice from an herbal perspective. And one of my favorites is actually the Cordalis formula for that more significant menstrual pain. Usually this is something that I would prescribe when they are actually menstruating. It's not appropriate to use during breastfeeding. So that's something that I have to be mindful of. But Cordalis is a root of a plant that's it is in the poppy family, but it doesn't have an opioid effect like you'd see an actual isolate of the constituents from such a plant like you would see in other opioid medications. The Cordalis formula is a mixture of the Cordalis root, peony, and licorice. So it's a pretty simple formula by Chinese medicine standards. Usually they're 10 plus herbs in a formula. But what I love about it is that it's helpful with that more extreme spasming, kind of exhausting menstrual pain. In addition to that, for women that have digestive issues and upset within their actual menses, the licorice can be greatly helpful for that. I usually am recommending it more acutely as opposed to as a consistent formula. I oftentimes will recommend additional Chinese herbal formulas or Western herb individualized formulas to take on a regular basis. And then the Cordalis formula is something that you would use when menstruation is actually occurring. So I personally have really seen good things with this, with the Cordalis formula. Usually it's a formula though that only providers can order. So something to be mindful of and ask your provider about if they're familiar with Chinese herbs. For individual herbs that are more anti-inflammatory or antispasmodic in nature, another Chinese herb, it's a singular herb that I really love, is Rehmannia. And Rehmannia glutinosa has a really great heat releasing quality. So for that reason, it's a wonderful anti-inflammatory. It can be relaxing to the muscles. And I also find it to be a useful ally when there's premenstrually and menstrually a lot of pain and angst that are disturbing the sleep during that time. So you can see that I'm matching kind of, I'm looking more whole picture and more constitutionally in terms of these choices, because you could choose other anti-inflammatory herbs like ginger, for example. But Rehmannia would be a really helpful ally if that person was also experiencing difficulties with sleep. I find too that Rehmannia is really helpful with that release of emotional angst. It's also an adaptogen, so it's supportive of the adrenals as well. You have to use it more long-term to see that kind of benefit. Rehmannia is also an herb that we've seen that a number of studies come out in the last few years of its benefit in autoimmune disease. So it's one that I will oftentimes prescribe in cases of autoimmunity. And so you can see why it would be a fitting herb in this regard, right? It kind of hits a number of different realms in this case. Ginger is a really great anti-inflammatory herb that I use. You usually have to use quite a bit of it, but I find it's helpful in cases where the pain is obviously inflammatory in nature, but there's a sharp stabbing nature to it. From a Chinese medicine perspective, that actually indicates that there's stasis and what they refer to as cold in the uterus or in the uterine tissue. And by that, they meant that there was a lack of flow in the pelvic area or where the endometrial tissue is. And how I perceive that as a Western practitioner is that that's related to the adhesions that have formed in the pelvis, right? So that really restricts movement, that really restricts lymphatic flow, that really restricts circulation. Ginger is a wonderful herb for getting the circulation going. And in addition, you get good gut support with it as well. Wild yam is another herb that I like to use for that more spasmodic pain that can occur with menses. And again, with endometriosis, remember, that's not just happening in the uterus, that's happening wherever that endometrial tissue exists. So wild yam can be wonderful in that regard as well. I really like evening primrose. The plant itself, I've only really started using the last couple of years as a tincture form, the actual plant itself. Historically, I've used more so the oil. And what I oftentimes will do is prescribe the oil in conjunction with a fish oil, more so with women. Some women are interested in how they process fish oil. I'll prescribe fish oil as an anti-inflammatory, for example, which can be, very effective. Some women, they actually have a tendency to, and I've seen it in more than a handful actually. If the fish oil dose is really high, what I'll see in some of them is that they'll get like the little hairs on their chin. And what I realized later when I was researching was that fish oil in very high doses can actually influence testosterone levels in susceptible individuals. So this is more of a clinical pearl. So oftentimes what I will do is simultaneously dose fish oil and evening primrose oil. Different types of oils in each of those sources. And the GLA, which is the anti-inflammatory component of evening primrose oil, I find for a lot of women helps balance out that kind of testosterone inducing, potential with fish oil. Now that's not going to happen in everyone, but I've just kind of noticed with women over the years that can come up for them. So balancing the evening primrose oil with a fish oil is usually how I help introduce oils that will reduce inflammation in cases of endometriosis. Now, what I have found the whole plant as a tincture to be helpful for is nervous tension leading up to menses. It's actually got a really nice flavor to it as well, I think. Again, cramp bark, partridge berry, cramp bark for more as an antispasmodic, obviously. Partridge berry, I like using, and also cramp bark as well. I like using when there is a heavier menses flow. The astringent factor can be really helpful for that. And when you think about why inflammation an inflammatory cascade happens for women when they have endometriosis and they menstruate is because of that excessive bleeding that happens outside of the uterus, in the pelvic cavity and the abdominal cavity. And so using astringent herbs that move, that classically move, things like partridge berry, that move but also reduce blood flow to a certain extent because of their astringent properties, I find that to be helpful in those cases. So that's something that I've noticed with people. Are there any questions about any of these herbs? Just so you know, for those of you that aren't as familiar with herbs, herbal formulas, for more intense dosing, I would use things like tinctures and solid extracts. But oftentimes I'm pretty heavily reliant on teas, depending on the flavor of the herb. So herbal medicines can be pretty powerful, even in, more dilute forms like teas. Oh, that's a great question. So this is a large reason why when I write a report for a patient, I'll write a priority list for them to kind of help them really integrate things into their actual life. What I find is that the manual therapies are most beneficial for tissue integrity in the short term, and reducing not only the occurrence of adhesions, but reducing future occurrence of adhesions. And then what I find the herbs to be most helpful for is kind of keeping the tissue state resilient enough to be able to maintain that structural change that you've initiated. So I find that at removing the endometrial tissue altogether, in my experience, I've found that the mechanical work has the most immediate effect. The herbal work has a more long-term sustaining effect on that mechanical work. And sometimes the endometrial tissue doesn't go away entirely. And the key is maintaining a reduced inflammatory effect. And that really employs both of those things, or really all of the things that we've talked about. What a lot of women will notice is that, particularly with food and the abdominal massage, for example, if they, life happens and they can't get on it for, a couple weeks or a few weeks, they will start to notice the inflammation starting to creep back up. Constitutionally, some of us are just much more susceptible to that. But I find the quickest way to get back on track is to first and foremost reintegrate mechanical work, and then, the rest as you can. So will the remaining endometrial tissue cause any long-term effects, even if the symptoms are removed? Yes, it can, absolutely. And this is another reason why I oftentimes will recommend and refer people to a pelvic floor physiotherapist, assuming that the endometrial tissue is in the pelvis. Adhesions sometimes can't be broken down, and that can restrict lymphatics, that can restrict circulation, that can impinge nerves. So it's really common for pain syndromes to perpetuate long after, maybe they had a surgery to remove the chocolate cysts and the endometrial tissue that they could see. But it's not uncommon for pain to perpetuate beyond that kind of procedure because, again, that cellular memory. So there certainly can be long-term effects from a pain perspective, um, from a fertility perspective, and of course, if that endometrial tissue is in other soft tissues like the respiratory tract, for example, much more rare, but it happens. Um, that can cause scar tissue to form in those tissues as well, which restricts function. Um, Now, consistent therapy and biofeedback and work on the tissues um, can bring you to a pretty functional place. But yeah, there absolutely can be some permanent stuff that show up for people. Um, any other questions? These are really good ones. We have a few more herbs and we have 5 more minutes. So I'm just going to go through some of these real quick and then we'll open the floor again. Again, I had strongly emphasized the importance of working on the adrenals and the nervous system and stress management. I've talked about Rehmannia and licorice briefly. Another favorite herb of mine that's an adrenal tonic is Schizandra. This again happens to be another Chinese medicine herb that I really like. Schizandra is helpful for a number of different reasons. You'll notice I have it in another category below. It's greatly beneficial to liver function and recycling of hormones, but it's also an adrenal support. What I like about Schizandra is that it also is this opener to the lymphatics, which is supportive of the immune system, but I find it to just be a really uplifting herb. So from an adrenal perspective, I think it's a really solid choice for a number of different reasons. And if you get it in a glycerite form, which I believe Avena Botanicals might make one, it's quite tasty. Motherwort is an herb that actually is the picture here on this slide. Motherwort, I find it's an herb that is beneficial for a number of different systems. It is incredibly bitter, so I warn people about that. But I find it can be helpful when there's a lot of nervous tension and anxiety around menses, which isn't uncommon if people are experiencing spasming pains and things like that. It can be beneficial in anxiety that induces things like palpitations. In Chinese medicine, there's actually this interesting relationship between the uterus and the heart. The uterus is actually considered a woman's second heart in that system of medicine. So this herb really addresses those two systems and that connection quite well. So really helps with the relief of nervous tension that causes anxiety, particularly around menses and things that are related to, hormone states. Supporting the liver is really key for hormone balancing. So using gentle but very effective liver repair herbs like milk thistle can be great. Schizandra is essential for, or is a really beneficial herb for liver support. Like I mentioned earlier, chasteberry, not as much impacting the liver, but is helps with hormone and cycle regulation in a number of different ways. If there's irregularity to the cycle, this is where it can be really helpful. Chasteberry is actually a dopamine agonist, which can be helpful if there is, if there is elements of, or if it's a case where you need that uplifting boost. If there's, I wouldn't say necessarily, a moderate to severe depression, but if there is low mood in relationship to the cycle, I do use chasteberry in those cases. But really a beneficial herb when you're trying to modulate the cycle and how it runs anyway, not just how it's functioning during menses. And then I mentioned earlier, Rehmannia is one of my favorite herbs for immune modulating, particularly in cases of autoimmunity. So again, you can see that that herb fell into a number of different categories. But any questions before we wrap up for the night? We covered a lot of material. Again, I'll be sending this video out to you in the next 24 hours or so with a few of the other resources that I mentioned. But definitely, I'll stick around for a bit of time here if you have any questions or any thoughts that came up while you were here. That's a good question. Not necessarily. What I find is that if people feel relief at the heat, the only thing that you want to avoid is having it on for very long periods of time. So, if a person has a hot pack on for an hour, that's usually too long. Not necessarily because heat is bad for you, but it does have a relaxing effect on the muscles. What I oftentimes will recommend to try is doing a bit of a contrast. So having a cold or cooler compress and take breaks from the hot with the cold or the cooling compress. What that does is that you open up the blood vessels and get good blood flow to the area with the hot. And then with the cold, it's squeezing the blood vessels tighter so that you end up reducing blood flow. But then when you bring it back to the hot, you open those vessels again. So you have this pumping action that happens when you do a contrast that actually can be really beneficial for healing the tissues and getting, oxygen and nutrients all to the space. So it can help with tissue repair more effectively. So that way, you're not getting rid of the relief of the heat, but you're also giving yourself an additional benefit with the contrast. Another thing that some people try is actually using, instead of adding a really high heating pad, is applying warming herbs, which aren't going to be, they increase circulation, but they're not opening it in the same way or applying such a long heat with a heating pad. So you can use things like Tiger Balm, for example, has a warming and a cooling effect to it. There's kind of icy hot type of packs that you can actually apply to the skin that again are going to cause that warming but cooling at the same time. So you're getting good blood flow to the area, but you're not putting a long hot on the tissues. So not bad, but try switching it up a bit to influence circulation a bit more effectively. No problem. My pleasure. I'm really glad you all were able to make it live tonight. I appreciate you being here.